Okay, it's Mari McInerney from Croaky back at the Oceania Tobacco Control Conference in Perth, the last day here. And I've finally found Professor Richard Edwards from New Zealand, who is going to talk about what's happening there. So can you say first who you are and what you're doing here?
Okay, so I'm a Professor of Public Health at the University of Otago in Wellington, and I'm a co-director of Aspire 2025, which is a research collaboration seeking to do research to help achieve New Zealand's smoke-free 2025 goal.
And how's that looking?
Well, you can sort of do glass half full and glass half empty, I guess. So there's some really good things. So the fact that we've got a goal and that we're absolutely clear what we want to do is get rid of tobacco completely, and by a pretty soon date, 2025. So that's really good, I think. There's been some good policy type initiatives, whether that's regular tax increases, getting rid of point of sale displays, or greatly limiting duty free, making prisons smoke free. So there's been a few things over the last 3 or 4 years that I think have been really good.
We're hearing the but.
There's always a but.
What's the big but? Plain packaging?
Yeah, so I mean, I think the two priorities we've got at the moment is getting plain packaging through. I mean, the government said maybe about 18 months ago, I think it was, after Australia brilliantly went ahead with it, that New Zealand would try and be the next country to do it, although we're clearly not going to be the next country to do it because Ireland and UK and Norway and other places are forging ahead. And we're sort of waiting for the outcome of the pending investors' dispute cases and so on.
That's particularly the World Health Organization.
Yeah, so the World Trade Organization and the Philip Morris one.
If only it was the World Health Organization, really.
So we're waiting on that, and the government said that they're going to wait on those. So that's and that could be a very long wait because obviously the industry knows that that's having a chilling effect around the world. So they've got no incentive to pursue those cases to rapid resolution.
But that didn't stop, as you said, Ireland from going ahead. What made New Zealand get nervous?
I don't know. Maybe just say Ireland's got a bit more guts than New Zealand on this one.
But where were the pressure points, can you say, with New Zealand on that?
Oh, well, I think that what the Prime Minister has said that they're worried about the possible legal sort of trade implications, and that until they're clear about those, they're not going to go ahead. But as I said, other governments have said no, we think this is important. It's worth trying to save lives through introducing plain packaging and protecting children and so on and so on. We're going to do it, and we haven't quite got that degree of political will at the moment. We're hoping that any day now we'll be surprised and there'll be an announcement, but it's not happened yet.
And you said there was a second?
On the second thing is tax. So it's just we've had a series of tax increases, just like Australia has, very similar. And the last one that's scheduled is January 2016. And so we're waiting to see what happens next. And what we really want is for there to be another sort of schedule of 4 or 5 years of clearly mapped out substantial tobacco tax increases, so everyone knows where they stand, that we know that there's going to be that continued driver to help people to quit and promote them to try and so on. So we're waiting to hear about that at the moment, whether that's going to be announced. Again, that may happen soon, but we haven't got it at the moment.
If we could come back to that in a sec.
Yeah.
But just on the 2025 one,
Sure.
What actually is tobacco-free? What's the target there?
So, well, the 2025 goal came from a Maori Affairs Select Committee investigation into the tobacco industry, and they recommended having a national goal of getting rid of tobacco by 2025. And the government adopted that goal, and they sort of quite carefully worded it, as they always do. So they said it was an aspirational goal, but they did say that they're aiming to get tobacco smoking down to minimal levels, and also the supply of tobacco to minimal levels. That's what it actually says in their statement. So that's really, really positive. I think what's happened, we've never to date really had the government fully behind that goal. So they've got some sort of health targets that the government has set, and they make great emphasis on those targets, and if they achieve them, they're really ones that they've set themselves, and they're very focused on achieving and proud when they do. And there's immunisation targets and things like that. We've never quite had that impression with the 2025 smoke-free goal. It's almost like they're downplaying it a bit. So obviously for us who are involved in tobacco control, we want to make sure that actually then that's not going to happen, that we want this to be foregrounded and this to be an absolutely major thing that New Zealand can really fly the flag and say, if we achieve this, this is going to be a huge achievement.
What would you need to get there?
I think these things generally come down to political will, really. We need
not just that but actually to meet the target. And when you say a minimum level, do you mean under 5%?
Well, it's become interpreted as under 5%. Some people would say, actually, no, let's get it much closer to 0%. But anyway, a very low level. It sort of doesn't matter in some ways, but we want it at a very low level. And the other thing that's very important, it's a very low level across the community. And so, for example, for Maori and Pacific people, because at the moment their smoking rates are intolerably high.
Sorry, I should have asked that at the beginning. What is that? What are their rates? Because that's been a big issue at the conference, of course, in the same way it has been around Aboriginal and Torres Strait Islander and other communities that have issues of disadvantage. So what is it in New Zealand? So
it depends sort of which survey you believe, but in the census, the smoking rate amongst Maori was about 34-35%. In some of the other samples, it's more like 40%, and Pacific is maybe between 25 and 30%, that sort of level. But the national rate is the overall rate is about 15, 16, so it's a lot higher.
So, and talking about taxes, I mean, and that's been a major issue here, or perhaps more beyond here too, about the impact of tax on disadvantaged communities, and particularly people, Pacific and Maori people.
Absolutely.
What are you doing there? You know, is there a way to try and deal with that?
Well, I think there's several ways of looking at it. So taxes are a very effective mechanism to reduce consumption and prompt quitting. They also seem to have a differential effect, a greater effect on lower income smokers, and that's been shown in a variety of places all around the world. So the effect, it's actually a pro-equity measure, which is great because most things we do don't work out that way. So it's really good that it's pro-equity. There are, of course, so the people who quit will have huge economic advantage because they're not spending lots of money on cigarettes. The people who can't quit, who continue to smoke, will have economic disadvantage. Now that's pretty inescapable, but what you can do then is try and mitigate that by making sure that you target all the support that you can at those disadvantaged smokers who are going to be most affected by the tax increases if they carry on smoking. And I think that's a social justice type thing. You have to do that. I'm not sure we do that enough. In fact, I'm reasonably sure we don't. And I think there's a very strong argument for if you increase tobacco taxes, you earmark the additional revenue, because it does bring in additional revenue, and you give that back to the communities most affected, the poorest communities, to make sure they've got all the support they can have to help them to quit. And I mean, long term, as people in those communities quit, they will be economically advantaged over time. So it is a good thing economically, but there is some short-term pain for the people who don't stop immediately.
And of course, that pain is for the people who are less able to withstand pain.
Yeah, and you know that's a really tricky one. I accept. There's Frank Chalupka, who's been at the conference, and he's just been out to New Zealand as well, has presented some interesting data on that. And for example, in Turkey, because of the greater effect of taxes on promoting quitting, if you look at disadvantaged communities as a whole, they actually gain from tobacco taxes net, whereas more affluent communities lose money because they're less likely to quit as a result of the tobacco increase.
It's a big argument, isn't
it? It is, but you know, it's not the only measure. And the other thing is, I suppose I should have said, the other really big thing we need a plan. We need a strategy to achieve 2025. So we don't have that, and we've not had that for the last 5 years or so, and we've been calling for it over and over. You know, the government, the ministry needs to set out, this is the strategy, this is how we're going to do this. At the moment, it's almost like they've set the goal and then just hope that we're going to drift towards it and somehow get there.
Yeah. Now the lack of an implementation plan is usually a bit of a sign, isn't it, of commitment?
It's not good. So we hear that there is currently a strategy being developed And that may come out in the next month or two.
Okay.
So we'll see. But to date, we've had nothing. And despite everyone saying the basic thing you need is a strategy for how you're going to do this. The tobacco control sector has developed its own strategy and said, look, this is what we need to do. But that's not the government's strategy. That's our strategy, if you like.
Let me ask you one last question, because it's about to go back in again. What have you gained out of being here? Have there been any major highlights for you in what you've heard?
Well, I think always at these conferences, it's really nice coming to a sort of Oceania conference because there's a lot of sort of shared experience and neighbourliness, and there's a real community feel, I think, amongst tobacco control researchers and advocates and practitioners. So I think that's always you get lots of reaffirmment, I suppose. You make new contacts, you re-establish old ones. So there's lots of that sort of thing, which is true of any conference. But I think this one functions very well on that score. And then you learn new stuff, and there's all sorts of things happening, particularly in Australia. Australia's leading the world in a whole load of areas of tobacco control. So it's always just great to hear about the latest ideas and evaluations of policies and so on that's going on in Australia and other places as well across Oceania. And there's interesting things happening in the Pacific as well. So,
what particularly, and how closely is New Zealand working with the broader Pacific on this? Because they're very much target markets, aren't they?
Yeah, I'm not sure how closely New Zealand's working with the Pacific. I suspect it's not as close as it should be, if I'm honest. But I think there's some interesting things going on with tax in the Pacific. There's been some really big tax increases. There's some interesting things going on with point of sale. I just heard Palau has got rid of point of sale displays. I think there's a lot of things go on under the radar which people aren't aware of in the Pacific region. Not related to tobacco, but I was hearing the other day there's a whole load of Pacific Island states that have sugary drink taxes. They've just gone ahead and done it. So you don't underestimate what's happening there. But I think I was just talking to some of the people from the Pacific just now. They really do need support, both for the sort of the detail of policy development and implementation and research and evaluation, all those things. There's issues of capacity and so on. But I think we could be learning a lot from the Pacific. So that's it's a good thing about this conference that we do get that breadth of that we could be learning from them. It's things like the sugar tax. Yeah, and sometimes doing quite radical things, which we're sort of umming and ahhing about and wondering whether it's possible. And sometimes you find in developing countries, they just go ahead and do it. And you think, okay, that's how you do it.
Good. Richard, it's going back in. Thank you very much. I'm just going to switch off.